I see patients with cancers of the bone marrow, which can include a wide variety of diseases, and also treat patients with stem cell transplants. So the other hat that I wear is in basic science and clinical research. That's really foundational for us at an institution like Washington University, where we are trying to improve treatments for patients, improve outcomes, and really push the field forward. And so my basic science research is founded mostly in stem cell transplant process, making that process and that procedure safer, but also making it more effective and reducing disease relapses after transplant. Every patient's journey dealing with cancer is going to be different, and we try to be intensely aware of that at all times. What we're offering is hope. Very important part of that is offering the support in order to get through those treatments. And that's why we have such big teams here at Siteman, which include social workers, financial coordinators, nurses, 24-hour-a-day coverage. That is a level of comfort that at least we can offer to patients. We don't always know what the future holds, especially a lot of times we don't know exactly what we're up against when we first meet patients. We still have testing to do. We still have more information that we need to discover before we can really lay out a plan for them. But right from the beginning, I try to make patients feel that they will have resources, they will be supported. Most importantly, that they have someone they can call and that they should call if there's ever an issue or a question. My father is a physician. In fact, he treats blood cancers and also does stem cell transplant. And so I think most people who are kids of physician, either when they're 3 years old, they want to be a doctor, or they say, I'm never doing that. And so I was really in the second group. And, my training was in engineering, and I worked, for a decade before going back to medical school. I didn't always want to do this, but something that really, as my life unfolded, made more and more sense, and really, once I started down this path, I haven't looked back. Really wouldn't change anything, but those experiences have, I think, brought value to kind of my whole experience as a physician. My father and I are lucky enough to work in the same place. His office is 8 doors down from mine, and so we get to hang out at work. Really the bigger thing is I get to ask him for advice since he's been doing this a lot longer than I have. So we talk, all the time about patients. We have some patients that we treat together. And, one of the best things is when I walk into a patient's room in the hospital and I say, hi, I'm Dr. Abboud. And they say, you look younger than you did a month ago. And they always get a laugh out of it because most of them know by now that, I work here and we're colleagues. So that's always a good time. And, it took a lot of hard work and planning for us to land in the right place, but we also got a lot of help, and it's been a lot of fun to work together. One of the best events of the year is our patient celebration, and that's where patients and staff and physicians all come together for a nice dinner. There's some awards, some speeches, but the best part is that we get a chance to visit with our patients and their families, and I always bring my wife, or this year I brought my daughter, and seeing the interest or just the care coming from my patients to my family members, and them sort of saying, your dad really helped me through a tough spot. That's a gratifying thing. It's very rejuvenating and recharges the battery and gets you ready to go back out and fight. One of the most gratifying parts of this job is seeing patients after they complete their treatments and their cancer journey. Seeing patients walk in years later for routine follow-up, coming in the middle of a work day, telling us about graduations, kids. It really makes all the hard work worthwhile.